Okay, great. Well, welcome everyone. I am Annika Izagari. I'm Communications Director with the Committee to Protect Healthcare. Thank you so much for joining us today, especially after the holiday weekend. We appreciate you being here. We are joined today by physicians in Texas, Wisconsin, Maryland, and Ohio, who are sounding the alarm on how Texas's House Bill 7, taking effect this Thursday, can harm patient access to abortion care, not just in Texas, but nationwide. Before we begin, please note that the physicians speaking today are speaking as individuals and with the Committee to Protect Healthcare, not necessarily on behalf of any employers. So we respectfully ask that you please only refer to them in any coverage as they introduce themselves, and please do not include employment information unless they expressly share that. So thank you in advance for being respectful of that. Without further ado, I will introduce our first speaker, Dr. Kumar.
Thank you. Good afternoon, everyone. My name is Dr. Bhavat Kumar. I'm co-chair of the committee's Repro Freedom Task Force. I'm joined by physicians across the country today to talk about the very real harms that a law going into effect here in my state of Texas will have on patients. HB 7, which will take effect this Thursday, December 4th, enables Texans to sue anyone, both in Texas and in other states, who prescribe, mail, or distribute abortion medication to Texas residents. Essentially, it allows anyone involved in mailing mifepristone or abortion pills to our state to be sued for doing so, from doctors to drug companies. Literally, anyone can sue. Texas politicians are allowing strangers to interfere in other people's personal medical decisions, decisions that should be between patients and clinicians. Texas already has multiple strict abortion bans in place. This law is just the latest way of trying to attack any access that people still have to this essential healthcare. This law is just another way for politicians to try to control women's bodies by making them afraid to order abortion medication and making clinicians afraid of prescribing them, even if they are legally allowed to do so in their own states. When politicians go after clinicians for prescribing abortion medication across state lines, they are attacking the doctor-patient relationship. Medical decisions should be based on a doctor's training and a patient's needs, not a politician's beliefs. I've seen the consequences of political interference in abortion care in Texas already. Doctors are afraid to provide care for fear for being thrown in jail. Many are leaving the state to practice where they can use their training and expertise without fear of criminal punishment. And patients are suffering. Some are dying. In the past few years in Texas, since overturning Roe, I've seen several patients riddled with fear about their options, what they can disclose to me, and more importantly, desperate for help. Help that we can offer with safe, modern medicine, but that the state is chokeholding. One patient that comes to mind was experiencing severe nausea and vomiting during her pregnancy. Unable to hold down food or water, she had already lost 10 pounds within weeks. She'd been to the emergency room numerous times and came into my clinic attached to an IV pole. She knew she couldn't stay pregnant, yet was too sick to travel to another state for care. Her only feasible option at the time would be to access care virtually from another state. But after this law goes into effect, that last option is being taken away from her and so many more like her. When politicians interfere in personal medical decisions, they traumatize them and cause them to suffer. When politicians allow anyone off the street in Texas to go after doctors in other states for providing healthcare, more people will die. We're speaking out on behalf of patients' health, freedom, and their very lives. Now like to introduce Dr. Callender.
Thank you. Hi, I'm Elena Callender. I live in Maryland, which has a SHIELD law. SHIELD laws protect doctors and healthcare providers in their states from hospital investigations, lawsuits, and extraditions from other states related to providing reproductive health care like mifepristone. 22 states and Washington, D.C. have SHIELD laws, or executive protections for reproductive health care, affirming their rights as states and their rights under Dobbs. But the Texas law going into effect this week is trying to change all of that. House Bill 7 targets healthcare providers in states who have, since the fall of Roe v. Wade, used telehealth to prescribe abortion pills. Here in Maryland, our law protects from liability the healthcare providers who help people out of state access abortion care. It also protects them from the state assisting with interstate investigations. But what I'm concerned about is how the Texas law could become a blueprint for other states and expand to impact additional out-of-state providers, like my colleagues here in Maryland. This state law basically dictates what other states can do. When anti-abortion activists pushed for the passage of the Dobbs decision, they claimed it was about returning abortion policy to the states. Now, those same anti-abortion advocates want to use legislation in one state to determine what doctors in another state can do. If successful, the law will make physicians even more afraid than they already are just for prescribing mifepristone, a medication that is safe, effective, and legal in their state. The ability for doctors in legal states to mail medication to people where bans block access keeps personal medical decisions between women and their doctors, which is exactly where they should be. HB7 is one piece of a broader effort to undermine access to medication abortions, the next stage of anti-healthcare extremist war on abortion and reproductive freedom. Right now, RFK's FDA is re-reviewing mifepristone, even though it has been approved for 25 years and has consistently been shown to be safe and effective. We are worried that this review will rely on junk science to justify eliminating access to the medication by telehealth, if not eliminating it altogether. At the same time, the court case against mifepristone's approval by the U.S. Supreme Court, which was dismissed in 2024, is now making its way back through the court system due to anti-abortion GOP state attorneys general, keeping open yet another opportunity for anti-abortion activists to get between physicians and their patients. This government interference from states, from the federal government, and from the courts must stop. Women deserve to make their own private health choices without fear. Now, I'd like to introduce Dr. Anita Samani.
As an OBGYN, I saw infant and maternal mortality rates go up in Ohio as abortion restrictions increased. So when the Dobbs decision was leaked in 2022, I thought it was time to run for office so that I could help protect reproductive rights at the state level. I'm both a physician and a politician, but I can say without reservation that politicians should not be dictating women's medical care. My fellow Ohioans agree. In 2023, Ohio voters overwhelmingly passed Issue 1 to restore residents' freedom to make their own personal medical decisions as a constitutional amendment. Nearly 57% of voters made it clear that healthcare decisions should be between patients and doctors, not in the hands of politicians. Yet, politicians keep trying to interfere. Texas HB7 is yet another attack by politicians on patients' health and personal freedom. It is yet another attack on doctors' abilities to simply do their jobs. It could allow people in Texas to reach into doctors' offices to say that what they can and cannot prescribe, even though the voters here have made it clear that they should be able to prescribe abortion medication. But the attacks on women's health care are coming from inside the House too. Members of Congress representing Ohio signed a letter late last week to Health Secretary Robert F. Kennedy Jr. and the Food and FDA Commissioner Martin Makary, calling for an immediate ban on mifepristone by mail. And just a few weeks ago, the Ohio House passed legislation targeting mifepristone. Passed under the guise of protecting patients, it would really just make it more difficult for patients to access mifepristone via telehealth, even though that has been done safely for years now. These political attacks from Ohio lawmakers, both in Congress and the legislature, are a slap in the face to Ohio voters who made their voices loud and clear 2 years ago. Republican lawmakers want to put government between doctors and their patients, no matter what the consequences to our patients' health. I saw the harm our state's abortion ban did while it was still in effect. We all know about the women who had to cross state lines. And the bigger issue is not only that it impacts women's health when it comes to abortion access, but it also impacts access to preventative care, like women getting pap smears. I recently saw a woman who was pregnant, but also had cervical cancer and had to make a decision in regards to treating the cancer or treating the pregnancy. Mammograms, birth control, all of these things are being impacted because of maternity deserts. We have maternity deserts in 13 counties in Ohio. These patients have to take time off work, find childcare, and then drive an hour or more to get the reproductive care they need. Telehealth has helped bridge the gap for many types of care, including mifepristone, and has made it possible to stay healthy without increasing costs, not only to the patient, but to society in general. This is why politicians shouldn't be dictating medical decisions, myself included. And now I'd like to introduce Dr. Lyerly.
Well said, adding myself included there, Dr. Samani, and we're all so proud of you and the work that you do, both in the political and the medical fields. Listening to my colleagues from Texas and Maryland and Ohio tell their stories, I can't believe that we are living in the United States in this time where we are having to fight for these fundamental rights. None of us thought that this was what healthcare was going to be like when we started this journey, and it is just beyond comprehension. Hey, my name is Dr. Kristen Lyerly. I'm an obstetrician gynecologist in Wisconsin. And like Dr. Samani and Dr. Kumar, I live in a state that had an abortion ban for a while after Roe v. Wade was overturned. It was an 1849 criminal abortion ban, and we were able to fight back and to win access back. But then guess what happened? HR 1 came along nationally, and we again lost access for a little while, and now it's back. But the confusion, patients don't know, providers don't know whether abortion access is available in Wisconsin or not, and we still have so many barriers. As a physician who has provided medication abortion in this state, let me tell you what it's like. If somebody wants a medication abortion, they have to come to the office, they have to meet a physician, they have a 24-hour waiting period, and then they have to meet the same physician just to hand them the pill. This is the same exact thing that people are seeking on the internet right now that we know is safe and is effective because we've got 25 years of experience that demonstrates that mifepristone medication abortion is safe, it's necessary, and it's life-saving. So when politicians say that they are looking out for women's safety, I can tell you they are absolutely not. They're just trying to control women. And abortion medication has helped many women get back some morsel of freedom over their own health. That's particularly true for women who live in rural areas, women with low income backgrounds, women in abusive situations, and so many other women who experience barriers to getting care in person. Restrictions on mifepristone, like what Dr. Kumar is dealing with in Texas, it hurts low-income women. It hurts women in rural areas disproportionately. It forces them to travel hundreds of miles for care if they can afford to travel to take time off from work, childcare, putting gas in their car. All of those things are barriers for people who can barely afford to put food on their table in this environment. Republican politicians are creating a healthcare crisis for vulnerable women who need reproductive care, but we're also facing a slippery slope. If politicians can successfully stop abortion medication today, what are they going to go after tomorrow? Birth control? It's already happening. Allowing politicians to override doctors sets a dangerous precedent, one in which your healthcare decisions aren't made based on medicine, but on political power and ideology. Wisconsinites don't want this. Texans don't want this. Americans don't want this. Americans value freedom, the freedom to make personal health care decisions with qualified professionals without government interference. Abortion bans that punish doctors and patients undermine this basic American freedom. Restrictions on mifepristone undermine this basic American freedom. We need to get back to trusting doctors, not politicians, with medical decisions. Thank you.
Thank you so much, Dr. Lyerly, Dr. Somani, Dr. Callender, and Dr. Kumar. We will now open it up for questions. The easiest way to get through them is if you could please type your question either in the Q&A or the chat box. If you could include your name and or news organization, that would be really helpful, and we'll try to get through those in order. And before we open things up for Q&A, a reminder that the physicians speaking today are medical professionals, obviously, not lawyers or legal experts. So they cannot speculate about legal questions or how HB 7 may be enforced, especially against their colleagues in practicing states. But they can, of course, speak to their medical experience and concern around the law and consequences to patients when abortion bans exist. So with that caveat, please feel free to type your question. Again, you can use the Q&A or the chat box. If you could include your name and news organization, that would be very helpful. So we'll allow a few moments for folks to be able to type those questions. I'm not seeing any yet, but I know it can take a while to type, so we'll allow a couple more minutes.
Or we made our position so clear that there's no questions.
In the meantime, too, I will say that we have been recording this. So if you'd like a copy of the recording, please let us know. You can chat me in the chat box here, or you can let Feldman Strategies know where you RSVP'd for the link, and we can get you the link to the recording as soon as possible. We'll allow one more minute. Well, Dr. Samani, I think you were correct. You made all your positions extremely clear. So I will go ahead and thank everyone for joining today. I know we're getting late in the day too, and you might have deadlines and all that. So we'll let you go. Oh, we do have a question in the chat from Mary Elise Cosgray with the Texan. Dr. Kumar, can you elaborate on how this new law will impact your work in Texas?
Sure. Yeah, I think what I worry most about is that even before this law goes into effect, we're already seeing patients that are very fearful about disclosing their use of medications. And certainly when we're taking care of people, we want them to be honest with us, let us know what's going on so we can help them. And it's already difficult to get information from patients because they're so fearful, given the number of laws that are in Texas, given some of the posturing from our elected officials, including our attorney general and our governor. And so I can only imagine that with this new law that will go into effect on Thursday, where folks can sue people, even if patients don't understand exactly what it means, which is often the case, there's just another layer of fear. It's a new law that's going into effect that's limiting their rights, limiting their ability to access the care that they need. And from my perspective as a physician in Texas, will really impact how comfortable, if at all, patients feel disclosing information. And it really tarnishes the relationship that I have with my patients, which is really unfortunate because that's a relationship that needs to be built on trust, mutual understanding, and an understanding that I'm there for their best interest. And when they're feeling fearful and unsure if they can say what they want to say and, really let their guard down, it really tarnishes the relationship that I have with my patients. And I'm worried that some folks won't be comfortable, but more importantly, some folks won't even present for care because they're so fearful, because they're so scared. And I really worry about those people that are sitting at home just waiting for things to get better and may not. And they should be able to access care with me or in an emergency room or wherever they need that care. And each law that's passed like this only makes it more difficult for them to do so.
Thank you, Dr. Kumar. There's a follow-up question from Mary Elise Cosgray. Are there any organizations that Texas women can go to for abortion access after Thursday? I don't know if you have information on that, or we could follow up with her. I'll turn it over to you if you have any response.
Yeah, I know that the abortion funds in Texas are still helping folks and providing information and some financial resources for logistical support. So they should still be able to help in the same ways that they have. And then some of the health centers that have been seeing patients and providing care will continue to do so. There may be some shifts after Thursday. I'm checked in with everyone, so we can definitely follow up with a full list of resources for folks.
Thank you, Dr. Kumar, and thanks for those questions. Another question from Amelia Jones with Fox 4 News in Dallas. How will you all fight this law since it goes into effect Thursday? Is it bringing physicians together and advocating like this? And is there any future action?
So just to answer, not in reference to Dallas, but here in Ohio, we are trying to clean up our laws, our legislation to be more in line with our constitutional amendment. I think that's going to be really critical because, in many states, there are old laws on the books that are contradictory to what current science approves, such as mifepristone being safe. So one of the things we've done is try to align our legislation with our reproductive rights amendment. And that's one way to make sure we protect physicians from criminal proceedings.
I would also add that the work that we do at the Committee to Protect Healthcare does exactly this. And the interest that we've seen from our colleagues across the country in pushing back on laws like this, especially when we recognize that these laws don't just affect people in Texas. You heard it from Dr. Callender. She's in Maryland, which is one of the best places to take care of women and birthing people, but it's still a threat for her there. So I think what you're going to see in the future is physicians coming together like we've never seen before, fighting back because we have to. We have to do it for our patients.
Absolutely. Thank you. Another question in the chat from Natalie with KFox14 in El Paso. What would you say to patients that are fearful or are not sure how this law affects them? Again, the question is, what would you say to patients that are fearful or are not sure how this law affects them? Dr. Kumar, do you want to take that at first?
Yeah, I can give an example or sort of speak to what I typically tell folks when I see them, which is it's always best to be honest with your healthcare provider and to seek the care that you need when you need it. I think given the last few years in Texas, I also tell patients it's understandable that you may not feel safe doing so. And if that's the case, you should do what's best for you and what makes you feel the safest. Oftentimes, we know of colleagues that work in certain places and can be, friendly places for people to seek care, and so we'll refer them to those places. But sometimes it's difficult to know exactly who a person will encounter in an urgent care, in an office, in an emergency room, from the front desk person to the care provider to the nurses. There's so many people that they interact with, and they may be fearful at every point that they interact with them, and having to tell their story over and over again can be also very scary for them. And so ultimately, I tell people to do what's best for them and to make sure that they're not waiting to seek care if they need it, and to do what's best for them. And we try to stay in touch with patients when they're navigating the system as well, and support them. All of this is also unnecessary. People should just be able to access care when they need it and not feel fearful. But this is the reality that we're in and sort of how we're helping people get through the moment that they're in.
Yeah, I'd also like to say, in addition to what you've just mentioned, we want to remind patients that we are here for them. We are not agents of the state or of any government. And our conversations, our whole purpose is it's between the patient and us. Our purpose is to take care of the patient and provide health care. We have no responsibility, to report anything, and our charts are closed. They're private, they're confidential. So it's important to remind patients that that's why we're here.
Absolutely. Thank you both. I am not seeing any other questions. Again, if you'd like a copy of the recording, please let me know. But otherwise, thank you so much, everyone, for joining today. I know it's kind of a busy, weird day after the holiday again. So thank you so much for being here. Thank you so much to our speakers for your time and your advocacy on behalf of patients in your states and nationwide. Thank you, Dr. Kumar, Dr. Callender, Dr. Somani, and Dr. Lyerly. We appreciate it. Have a
Thank
good
you.
rest of the day, everyone.